Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
About 6 years ago, I was placed in a boot that sort of restricted this movement for almost 6 months.
Why?
And
Why you had the boot? What happened?
A slight case of Achilles tendonitis.
So you had Achilles tendonitis. The prescription was using a boot for that. Okay.
And then
You said for 6 months.
6 months.
Okay.
So we never regained the range of motion back, and up until this point, I tried.
Let me see your range of motion. Okay, can you see it? Go down. Okay, let's compare it with this one. He's going further more up and down. Let's do the other one. Yeah, and very stiff. You can see the range of motion is very slow.
The biggest thing is when this hits its peak.
Okay, how much pain
It's
there from
rigid.
0 to 10?
When you get to right there, its peak, it's screaming. It's probably a good 6.5, 7. Like right here, I'm at my peak, but if you was to grab it, you could get further.
Okay.
This right here, when it gets its peak,
You
it's
start to muscle spasm or sharp
spasm
pain.
or
Okay.
sharp knife pain
Okay.
or
You feel the sharp pain in
Oh,
the
yeah, I
calf
feel
or
it
the
just-
whole thing?
right now
How
I
much
feel
from
it
0 to
right
10?
here. It's probably about 6.5, 7. I feel it right here, right in here, and right up through here.
Okay, so that was 6 years ago, and you had 6 months of wearing the boot. What other treatment you have?
Everything. Physical therapy,
Physical therapy,
acupuncture,
acupuncture,
massage,
Massage.
chiropractics,
chiropractic.
orthotics,
Orthotic.
AFOs. You name it,
Okay.
I've done it.
I'm sorry. Okay, so you did everything in the book.
Yeah.
Okay, so how much pain at worst from 0 to 10? And when I was interviewed before, you were saying after wearing the boot, you start to have issues everywhere else. So can you describe lower extremity, what else happened after wearing the boot for 6 months? And that's very common, by the way. When you wear a boot, it's like your car out of alignment. So that's gonna cause leg length discrepancy. And if you wear it for a long time, that's gonna cause wear and tear on one side more than the other. Like when you have your car out of alignment, for example, in your case, your car out of alignment for 6 months. What do you expect? You're gonna wear a lot. Do a lot of wear everywhere in the lower extremity. If it's a shorter period of time of wearing the boot, it's not going to be as aggressive. But the idea of wearing a boot for tendonitis for 6 months, it's kind of extreme approach.
Yeah.
Okay.
So on this leg, it's always the hip flexor, which when all of this happened, I never got regained function of this hip flexor. I'm locked up there.
Locked up there.
Every once in a while, I don't know why this does this, but I get my anterior tib
It's
goes in spasm.
compensation.
Yeah.
Because you're not contracting the correct muscles here. So you have to compensate.
Yeah.
So instead of your weight even 50-50, you decrease the weight on one side, you put it like 70-50, you just walk funny.
Yeah.
And that's why you start to have issues.
And this posterior tib, I guess, is what causes this swelling. It's not too severe at
Okay.
times, but it just swells a little bit right there.
But the right side is the worst.
Oh,
That's
yeah.
when it started. So we're gonna focus on the right side. We're gonna work on both of them. I noticed when you came, you were using cane. Can you explain to me what's going on? Why you use it? Do you feel your balance off, or because
Oh,
of
yeah,
pain? What's going on?
Up until it took me I was on a walker. I was stuck at neutral
Okay.
and on a walker for over a year and a half
Okay.
after I got out of the boot.
Okay.
And then I had about 2.5 years to where I could walk and do things halfway normal, but I knew my walk was way, way off. I was compensating, and then about 6 months ago, I guess the compensation I was doing ended up getting my back, and I don't know if it was
So
my
you started
SI
having back
joint or
pain.
what. Yeah, and I don't know if I got sciatica or what, but it.
Do you have back pain going down to your legs, or just localized in the back?
I don't know because my leg hurts all the time. Now the back.
So how much
hurts,
constant pain from 0 to 10? 10 is emergency room.
Probably 3 or 4 constant.
Constant pain. And when it gets worse, how much from 0 to 10?
Probably 8.5.
Okay, so I will have you walk and you want to give me numbers. How much pain? Well, hold on. So you came with the cane.
And the cane slows me down.
Do you need to use it or can you walk
No, I
without
can
it?
walk without it.
Okay, so we'll have you walk in the whole way back and forth. Let me know how much pain from 0 to 10 and where do you feel it.
Okay.
So we'll walk this way. So I just gonna describe how you walk. You just know what you usually do. So your gait extremely slow, very stiff. You have really very wide base of support. How much pain and where do you feel it?
That wide is not normal to me. I just
Just to compensate.
When I come close in, this hip and right through here
Okay.
is extremely tight.
Well, I can see you really don't have a lot of ankle movements to go back and forth. Typically, especially the left and the right, you need to have some ankle movement to clear up your foot to do heel toe walk, and that's a normal gait. I'm not seeing that. You just your feet flat on the floor. Landing. That's very typical with a lot of stiffness, and you can see the limping a little bit. How much pain now from 0 to 10?
Probably about a 5.
Where?
Right up through here,
Okay.
and then right in here.
Okay. You feel this knot here?
Yeah.
Make sure it's pain free, okay?
Yeah.
So, I have a tool actually to go deep and work on deep scar tissue. This is what I'm using now, and deep fascia restriction. How does that feel?
Feels all right.
Okay. So I'm actually trying to release the scar tissue and the deep fascia restrictions. Make sure it's pain free. Okay. How is that?
Feels all right.
If you feel pressure, that is okay. If you feel pain, it's not okay. You okay there?
Yeah, it's a little twingy, but I mean it's fine by me.
Okay. As long as you don't feel pain, that's fine. Okay. You feel this bump here?
Mm-hmm.
That's a scar tissue. And anatomically, you should not have that hardening that go back and forth like this. You feel that? Can you see it? You see?
And here recently, it's gotten lateral. I think I'm rolling over my ankle.
It's gonna change because you're gonna change the compensation because
Exactly.
you are tired and that's painful on the side, so I'm gonna walk funny on the other side. It's just gonna be all over the place. That's why with this situation, it's gonna be like random, based on the compensation, and that's very typical after wearing the boot for 6 months.
On the hamstring and behind the knee, it's usually on the medial side, but
Feel the scar here. So when you have scar tissue that should not be there, it's like you have a piece of rock that if it's too thick, it could compress on nerve, artery, or it's also limits the range of motion, so it could cause a lot of symptoms. Is that too much?
got diagnosed with a form of Guillain-Barré and dystonia.
Really?
And torticollis, yeah.
Are you serious?
Yeah.
Did
I've
you
been to
have?
Mayo Clinic. I've been everywhere, and I'm with you. I think it's all just compensation injuries.
Guillain-Barré? How they came up with that?
Because when they put me in that boot, all these things started popping up, and I got extremely weak coming out of the boot, and they just could not understand why I was on a walker, and I'm like, I can't walk, It's
Wow.
I have no idea why.
So they diagnose you with a lot of different diagnoses.
Yeah, a bunch of
Oh wow. Okay.
diagnoses don't mean anything there.
Well, it's basically labeling you, but is that gonna?
It does nothing but
Yeah.
say that they put a name on.
We're gonna do the nutrition analysis to make sure you don't have any deficiency, that your body is healing fast. So I'm working on a superficial fascia now. You feel, so normal fascia movement should feel like this. You feel the mobility?
Yeah.
So I'm using ASTR tools to, this is a good fascia mobility actually. But here you feel the tightness?
Yeah.
So I'm gonna release it with the tool.
That's one of the areas that sort of hurt.
Fascia is like, well, the superficial layer is like a Spider-Man suit that wraps the entire body. Very thin layer under the skin. So there's a layer wrapping a group of muscles and a layer wrapping each individual muscle and each individual fiber. When the fascia is tight, it's like you're wearing a t-shirt 2 to 3 size too small, and it feels like something cramming like this. So that's what I'm using to release the fascia layers. How's it feel?
That's fine.
Well, we definitely need to work on your gait, but I cannot do that unless releasing the tightness, because if I give you feedback to correct your gait and you still have the tightness, you're not gonna be able to correct it. Does that make sense?
Yeah.
Okay. And here on the left, what's going on? Where's the worst area?
It just comes and goes. If it comes, it's usually in that medial gastrop. It get really tight.
Medial, okay.
Yeah. And
Okay.
then
Medial gastric, it's the inner side of the calf. Okay, go ahead.
and then that anterior tib.
Anterior tib is the front of the tibia bone in here. Okay, what else?
But the only thing that's chronically there all the time is the hip flexor. On
So
the
hip
left side.
flexor on the left side, and then, okay, we're gonna get to that, but just let me focus on the lower extremity for now. So hip flexors on the right side, yeah. Have you had any surgeries or anything?
No, I've had 2 knee debridements on the right.
Why?
I don't know. Everything I've ever done, I've never got a clear answer from.
Okay.
I dislocated / I don't know, my knee when I was 17 years old playing volleyball. It came out of line and got
So
stuck there.
did they remove anything or just debridement?
Debridement, and the second time they did it, they debrided, and I think they did take a little bit of the.
Meniscus?
I want to say they took a little. No, I think they just shaved the cartilage and reshaped it a little bit.
Sorry about that. Okay, so I'm working now on the scar tissue. Feel those bumps?
Yeah.
That's all scar tissue. And you can see the map of the scar tissue here where there's the redness. And here. Feel that bump here? That's a big scar tissue here. Feel that?
Yeah.
Normal muscle should feel like nice and smooth like here. But when you have those, so scar tissue, our muscle should act like a rubber band, contract and relax, stretch like this. So when you have a scar tissue, it's like you have a knotted rubber band. So when your muscle contract, does not really stretch much. And here we already know that, and when we saw that his range of motion for the ankle decreased significantly. I will not be surprised when I see all the scar tissue here, because the calf muscle attached from here all the way down, that calf muscle will not stretch. So it will limit the ankle range of motion. And you can feel here in the lateral peroneus, a lot of your scar tissue and lateral, your part of the calf, which means outside. You feel that one here? That's a deep end. Is that too much?
No, I'm good.
Okay. You feel how nice and smooth the medial side?
Yeah.
So your compensation more outward. Okay, and right here, the Achilles tendon. You see it medial lateral of your ankle. Okay. Do you have plantar fasciitis?
I don't know. I don't think I did. I think it's something with my big toe.
Okay, don't kick me, okay?
All right.
So you feel this grinding feeling? That's a scar tissue here. I feel it here right in this plantar part of the foot. Okay. Sorry. Is it ticklish?
Yeah.
You see, it's fun to be here, you know? Too much? Okay. So I feel the grinding. I'm like actually feel like I'm going over like sand, but or small rocks right here. And Achilles, plantar fascia. And you can see the scar tissue here in his IT band. Look at this. You see that redness? IT band and his hamstring. Look at that. Feel that? Can you hear that? All this grinding. Is that too much?
No.
Yes?
No, that's fine.
Okay. Here, it's actually not too bad compared to. That's very. It feels like washboard in here. Sorry. Okay. Here. And we really can map the scar tissue where the redness. Relax. So I'm actually not gonna use the Magna Heal for inflammation because I wanna rule out. Are you primarily stuck in a proliferation stage, or are you going back and forth between inflammation and proliferation? Those are the stage of normal healing cycle. So proliferation stage means like you're stuck in the scar tissue, fascia restriction, muscle spasm. So we'll have you. Usually, like your gait usually slow, or since that happened, it's been slow. I know it's been 6 years, but before the 6 years, you usually fast walker.
Oh yeah.
Okay, if you don't feel pain, walk normal. How does it feel now, from 0 to 10, and where do you feel it?
It's definitely better.
Okay, is it gone, or you still feel it? You can see the redness. You see his hamstring, you can see the scar tissue. Where do you feel it?
Feel it right through here.
How much from 0 to 10?
It's probably about a 4 right through there. And the other,
You're walking a little bit faster, actually.
other area I feel it is right in here.
So this spot and just 2 spots. Because
The main areas,
you were complaining of 6 spots all over, yeah? So I just want to know the exact spots so we can work on it and we'll have you walk again. Just those 2 spots, the medial calf and the medial ankle or lateral ankle?
Or the lateral, right in
Okay.
here.
So let's have you lie on your stomach again.
Yeah, but it feels better. It's a little tight right in here.
I did not work on this with the scar tissue. Let me work on both of them and we'll have you walk and see how that feels. So normally, relax. Your body go through this process. It could take like a few days or weeks, months or years for your body to break the scar tissue by itself. But when it lasts pretty long, like you're young, so my expectation for you, if everything is perfect, should be like 6 weeks max to really your body dissolve it. If that has not been dissolved, there's a couple of issues. Well, we need to have mechanical force with the tool to break it. That's one thing. The other thing is for the patient who has really very rough scar tissue, we know what the scar tissue consists of. So we're gonna do the laboratory testing after this or the nutrition analysis. But it's very common with patient that has high level of calcium and imbalance between calcium D and magnesium and K.
That is extremely tender in there.
Sorry, that too much?
No, I'm just saying that even a light touch in in that little area right there. Phase tender.
So I'm gonna have you walk again, and if you still feel some discomfort, I'm gonna jump to work on inflammation, okay? So if you have a balance between calcium, D, magnesium, and K, your scar tissue will be hard, will not be dissolved by itself. That's why we have to look at those levels to make sure that the calcium is not depositing in your soft tissue, and that's actually a red flag, because if your calcium does not deposit in the bone, it deposit in the soft tissue, which include musculoskeletal system, the muscle and the arteries and vein. That's cardiovascular disease. That's the plaque. So that's a red flag for me that if someone has a scar tissue for a very long time, that their body does not dissolve it, there's an imbalance here. With the tool, if that imbalance not too severe, we can get rid of the knot immediately. Some patients just a few seconds or a minute with the tools to get rid of it. But if it's too hard that requires several sessions, and you start with history like yours, I will be very anal about the ranges, because even the conventional range in the laboratory testing, they base it on a study 30 to 40 years ago that actually has not been updated, and the normal range actually should be smaller. So when you go get the lab work, they will like, oh, it's normal. No, that's not normal for you or optimal for you for your condition, because you're building more excessive scar tissue. There is this deposited in the right spot, and that's what we're going to look at. So let's have you. Any pain, or it's gone?
It's definitely better.
Is it gone, or you feel pain?
The only real tight spot I feel is right through there.
Okay, we want to distinguish between pain and tightness, because you're gonna continue feeling the tightness because you have a lot of scar tissue, and that's gonna take a little bit time to shave it. My concern is now is the pain. The tightness that's gonna take a few treatment. My concern is the pain. But if you have tightness, I'm gonna use the MagnaHeal to see if we can decrease that localized inflammation.
Just a slight bit of pain
Right in here.
right in there.
And everything else we worked on is cleared. So let's lie in your stomach. So I use the MagnaHeal. It's a special magnet, and I coat it with anti-inflammatory coating to work on the inflammation. So as I use it as a diagnostic and treatment tool. So if you have just mild inflammation here, with the MagnaHeal should take like a few minutes to decrease the inflammation. If few minutes is not enough, that's mean you are having moderate to severe inflammation on that spot. That's why I did not use the MagnaHeal initially, because I want to distinguish, are you stuck on this area in the proliferation stage, or you have some inflammation. If you don't feel pain, I want you to start to walk your normal speed, okay? Because that's eventually what we need. What I notice is you walk, okay? So just nice and tall and walk. How is that? Any tightness or pain?
Feels pretty good.
Okay, normal speed. Let's do that. Okay, couple of things. Normal gait, heel toe walking. So really land on your heel. Pick up this foot. As long as you don't feel pain, just do that. Suck your stomach in, nice and tall. So we're gonna practice normal gait after this. I just want to make sure to challenge you a little bit to see how you respond. I will assume no.
But the only pain is right here in that big toe.
How much from 0 to 10?
About a 3.
When you do the heel toe walking?
When I try to push off a little bit harder.
Because now we try to train the new pattern of normal walking. Both of them.
I think it's big toe on this one. I think it's the second toe on this foot.
Is it the toe or the metatarsals?
I think it's the metatarsal.
Metatarsals. Okay, so let's line stomach again. You see now, it's actually because we start to have normal gait, you start to notice the other tight area. It's not your pain traveling, it's just because you have not used this area for a very long time. There's a lot of stiffness there. It's right in here? Yes?
Yeah.
Okay, so don't kick me, okay?
Alright. Do you know anybody that's close by that does a lot of gait training?
To be honest with you, you can do everything at home, even working on yourself. I have the online program for the foot that show you the proper gait training.
Okay.
It's a step-by-step and using the tools in case if you still have some scar tissue, we did not get rid of it in the 2 days you are here in California. That's what I usually discharge patient with. The toolkit and the online program that has a step-by-step to use the tools and the exercises, the gait, the anti-inflammatory diet, the behavioral modification. We'll go over the proper shoes, the proper orthotic. So it's basically those programs, everything that I do with my patient for those conditions, except I'm not the one doing the manual stuff. The patient just have. You can do it on your own, and some areas in the back, your spouse can just do it. It's take 5-10 minutes a day to do it. Sit up for me, drink some water. But I'm gonna give you some feedback now. But in that video, I have a model. Usually, if you follow simple command, you do more complicated stuff as a dentist. So that program gonna be like just nothing, you know. But we really need to walk properly, sit properly, all of that. But I gotta go over the way you work here because that's not in the program. As a dentist, bending forward and stuff like this. So the stuff is not in the program, we'll go over it here. Normal speed. Puncture, you had boot, you had a lot of different modalities and treatment, and your background like a dentist. So what do you think about ASTR treatment? How do you feel with the treatment? Just working on it for like a few minutes today.
It definitely feels better, for sure.
So,
I mean, in the little bit of time that we spent on it, it definitely helped out a lot better than massage or anything like that.
Have you had any treatment before that you experienced change like this in just a few minutes?
Just a few minutes. Mm-hmm.
Yeah. And that was 6 years ago. You had boot for 6 months. You had everything under there. So,
yeah.
Awesome. I'm glad you're feeling better.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.